Without further ado, I'm going to hand over to today's presenter, who's Dr Lindsay Richards, who is a lecturer in the Department of Sociology here in Oxford, and she's going to be presenting on the childhood origins of social mobility, which is for the Social Mobility Commission here in the UK, and within this there's also some examination of childhood wellbeing. So I'll hand over to Lindsay now.
Thanks you very much. While you're sorting the slides for me, thank you. Brilliant. Hello, everyone in the room and everyone online. Thank you so much for inviting me. It's lovely to be here. A special hello actually to Andrew Oswald, who examined my PhD 10 years ago this year, actually, May 2015. So it's nice to see you. So thank you for the introduction as well. So this was a report that I did for the Social Mobility Commission. Oh yeah, I should mention before I get going, my name is in big letters, but there's a huge amount of work from other people on this report. Special mention to Lewis Anderson and Yang Yu, who really, were a huge part of the efforts behind it. Okay, but I'll begin by telling you just a very little bit about the Social Mobility Commission, in case you haven't heard about them before. I lifted this quote from the Wikipedia page, which basically describes how the Social Mobility Commission is an advisory, non-departmental public body of the Department for Education. It also tells you its former names. It started off being the Child Poverty Commission, and then they added in the word social mobility, and then they dropped the poverty part altogether. So just sort of looking at that trajectory, I think quite telling about this sort of, perhaps government shift in emphasis from equality of opportunity to equality of opportunity. And that's what they say about themselves, that they basically exist to help create a society where the circumstances of your birth don't influence how far you can get in life. So a bit more background as well. This is actually the second time I've worked on this report. I originally worked on it in 2016. And on that case, we'd responded to an invitation to tender to do the work, and on this case, they invited me to work on an update. So there are some changes between that first report and the second one. Oh yes, I was going to mention, highlight of my career, the impact that we had from that first report. We got tweeted by Katie Hopkins. Yeah. So for those of you who haven't heard of Katie Hopkins, she's I think known as a bit of a mega troll. She was kicked off Twitter for hate speech at some point after this, but her account has been reinstated. You won't be surprised to learn. So that's the first step of the background. The other part of the background is that report in 2016 was originally commissioned in response to a book that was written by Robert Putnam, who I'm sure many of you have heard of, who's also had some very high impact work, notably his book on social capital called Bowling Alone. And this one was called Our Kids, and it had a similar sort of impact. So it was taken very seriously by policy makers, and they were essentially, this report in 2016 was commissioned to do a kind of British version of Our Kids. So that was a book with American data. So Putnam's main points there is that if we care about the social mobility of kids in the future, we should sort of look at their lives now and not wait till they become middle-aged and measure their occupations. So he identified sort of various aspects of the lives of young people, and then sort of systematically measured inequalities in those. Essentially, he starts out by telling us that the American dream has died. 50 years ago, family background had very little to do with who finished college, and nowadays it does. And that escalator that carried up the class of 1959 suddenly halted when our own children stepped on. So it was a rather sort of gloomy starting point. to the book, and one that really wanted to highlight inequalities. So the aim then with this new report in 2024 was largely to sort of just update some of that work that we'd done in 2016. Obviously a lot of things had happened in between. We'd just had the pandemic, and there were various ways in which life didn't look quite the same after that 8-year gap. We decided in the end to put a bit less emphasis on the Putnam approach, which was this kind of diverging destinies approach, and we put more emphasis on the cross-sectional inequalities. Today I am going to be showing you a bit of a mix actually of cross-sectional and some over time stuff. Excuse me. So we're maintaining a focus on the domains of life in childhood which we think are likely to influence children's chances of doing well, however we want to define that, being upwardly mobile, having success in education and occupational life. But yeah, because of some of those societal changes that had taken place, I decided to put like a new emphasis on mental health in there. Obviously there's been sort of wide publication about a possible crisis in adolescent mental health, largely I think arising around the time of the pandemic. And then of course it was interesting question to me to look at actual experiences in children's lives during the pandemic and their home learning environment. And then also the Commission themselves had asked me to do like a bit of new emphasis on parental values. So I'll mention a little bit about that as well. So I've got loads of graphs to share with you today. It was quite a big, expansive report, so I'm not going to spend very long talking about a theoretical background or literature, but I'll just mention a couple of key points. One of them, I suppose, is that you, as well-being researchers and scholars, might all be used to sort of treating well-being as your outcome variable, and that's the thing that we're interested in. Whereas my work on well-being in this report was actually then interested in this idea of well-being as a mediator, so that a child's well-being during childhood might have consequences for their later life, socioeconomic status, such as their educational and occupational attainment. Thank you, that's very kind. So a little bit of background there. There's like a well-known link. I'm using SES here as shorthand for socioeconomic status, and I'm using that term sort of really broadly, covering class and education and so on. So there's a known link between your socioeconomic status and your health and well-being outcomes. So people with higher socioeconomic status basically have better health and better well-being. But the causality of that arising from the literature is sort of known to work in both ways. So one of them might be that sort of being in a low socioeconomic position will cause a reduction in your health and well-being due perhaps to your work conditions or having low pay. But we also know that having poor health and well-being can sort of cause you to slide down the socioeconomic ladder, right? If you imagine, maybe people with poor mental health are going to be more likely to drop out of the labour market, go part-time, go for an easier job, and so on. And so that's sort of what we know already. And then the idea here, and I'm drawing on Lewis Anderson, who contributed to the report, wrote a paper in 2018 where he looked at this question of whether well-being during childhood influences your social mobility. And it turns out that it does. So he uses some measures of adolescent mental health and behavioural problems using the Strengths and Difficulties questionnaire, which is a sort of a well-established survey tool for gathering information. and then sort of deriving these measures of what they call conduct problems, hyperactivity and emotional symptoms. He found in that study that indeed it, having those things in childhood influences your chances of either being upwardly or downwardly mobile, I guess, in the direction you'd expect. The pathways then, just to sort of mention them in passing, is that you might expect poor health and well-being in childhood to have a direct impact on education and educational attainment, and that in turn would lead to lower socioeconomic status. And of course there might also be a link between poor mental health in childhood, poor health and mental health in adulthood as well. I'll mention a couple other things from the literature review really quickly. So a couple of some of the important studies that I was drawing on, for example, mentioned that parenting style is particularly important. And so, for example, an authoritarian parenting style might lead to worse education. We've got authoritative parenting leading to better education outcomes, authoritarian to lower self-esteem and higher sadness. We know that parental involvement at home matters, so showing interest in education, doing activities and doing outings with children. This last study as well, mentioning things like museum visits, books at home, parenting style, so this sort of home learning environment that can also influence how well children are likely to do. So these aren't really directly to do with well-being, apart from the top one, but these are things that will sort of matter in childhood, that matter, likely to matter for your social mobility chances. So when I was thinking about how to structure the report, I was sort of thinking about these sort of key divisions, what are these different domains or areas of life that are interesting. And so I've decided to make this distinction between parental endowments and parental investments, and just in sort of very simple terms in my mind, I suppose I think about those as being what parents have versus what parents do. We don't spend a lot of time in the report talking about how much money the parents have. I guess we just kind of assume that from the socioeconomic status, but we think about those endowments of things parents have in terms of values, their social capital, their cultural capital. Those investments then are mostly not about money or indirectly about money. They're about time spent reading, doing activities at home, navigating the education system, and then also sort of investing in the relationship, eating family meals together, and that sort of thing. And then a final chapter then on the sort of the lives of the kids themselves, so home and school life, their mental health, experiences of the pandemic. So there's 3 main chapters, and I'll show you some results from all of them today. We use a whole ton of survey data. The UK HLS, also known as Understanding Society, and its predecessor, the BHPS, or the British Household Panel Study, and the Millennium Cohort Study were probably 2 of our sort of key resources, but then also a number of other British survey resources. The methods are extremely simple. We're just looking at weighted means, sort of differences between the different parental socioeconomic backgrounds. I refer in general to parental socioeconomic status. Most of the graphs I show you today are actually based on class. Throughout the report we use parental class and education. They largely show the same kind of patterns and same results. There are some exceptions today for convenience, and 1 or 2 of these surveys rely on other measures to get at socioeconomic status. And just to sort of emphasise this point, that the scope of the report is to emphasise inequality in the antecedents to social mobility. So we think then that there's a link between socioeconomic background, those precursors to doing well that might include, helping with homework, all these cultural activities and child mental health, and we think they in turn matter for your socioeconomic attainment, but the scope of the report is to sort of, paint a picture of what's in the yellow box. So we're looking at the socioeconomic patterns of those precursors to doing well. Let me just skip through that. I think, as you've already picked up, only part of the report is about well-being, and I'll just sort of give an overview of all of the findings, but we get to the well-being part towards the end. So chapter 1 then, on parental endowments, and I'll just sort of leap straight into it. Excuse me. So the report is full of charts like this. I'll spend a bit longer on the first one. And this one is a nice one to start on in a way, because it shows a nice gradient, right, a socioeconomic gradient. So we've got, over on this side, we've got the higher professional, which was our highest categorisation of social class, versus the lower working class on the other end. So this is one dimension of social capital. It's neighbourhood trust. And if we just sort of take the top two colours, we've got amongst the highest socioeconomic group here, we've got 63 plus 13% agreeing, so that's 76% versus 7 and 43 of the lowest socioeconomic group. So quite a big difference in the level of trust. I'll skip straight onto the next chart, 'cause it's also conceptually quite similar. This one is satisfaction with amenities in your local area. So the gradient isn't quite as pronounced here, but still quite evident. So telling a similar story really, that those kids in the higher SES families are living in areas which are nicer, more trusting, better local amenities. I'm sure, as you know, there are tons of ways to measure social capital. We do have some others in the report as well, so this is just an example. This slide then is showing cultural capital. So this is about the activities that parents do. This time it's split out by education rather than class, and that was for the very simple reason that it was much easier to show this in 4 categories. So we've got the degree holders, the highest SES group up here, and then the parents with no qualifications down in this quadrant here. And then the different coloured bars are showing the sort of rates of participating in various different types of cultural activity. So one of the things that I found really interesting about this picture is, kind of contrary to some of those cultural capital type narratives, we don't see any kind of highbrow, lowbrow distinction. People from all the different socioeconomic groups are doing the same types of activity, right? The top activity for everyone is going to the cinema, and the second going to the museum, and then the theatre, and then live music. So the kinds of activity that these families are doing are all very similar, but it's just we can see that those in the highest socioeconomic group are doing a lot more of them, frankly, right? So the kids in those houses are just, being exposed to a lot more sort of different activities and different culture. Just to note as well that this particular survey, the participation survey, was done sort of very much with the context of the pandemic in mind, and they also had a battery of items asking about online activities, just sort of, any streaming and watching stuff on TV, but you find like a similar sort of pattern there, that essentially the high SES households are just the ones doing more stuff. This next one is about parental values, which the wording of the question was about the qualities that you'd most desire your child to have. And I'll just sort of focus in on one of the key findings, which is this blue bar, which was very popular, which is wanting your child to be able to think for themselves. And as you can see, amongst the high SES group, there's 63%, so a large majority, sort of emphasising that this is, you know, how they would like their child to grow up. And that's much lower than in the low SES families, where instead they're sort of also emphasising a little bit more things like obeying their parents and working hard. Oh yeah, there is one more. So the last one about values then in this section is showing parents' interest in, this is like STEM, but with an added A, so STEAM, because it's got the arts in there as well. So parents being interested in the arts, science, technology, engineering and maths. And we find sort of pretty low levels of interest in maths in families. Perhaps that's not very surprising, right? Or engineering. But the general pattern is there to see, which is basically whatever it is and whatever the level, those in the higher socioeconomic families are sort of, they've got more interest in more of these things. Okay, I'll probably just sort of skip through this. I've just put this like summary slide as a kind of reference, but most of the key things there we've mentioned in passing. So let me sort of skip on to chapter 2, parental investments. So I suppose this is a bit of a classic one, helping with homework, and I'm using the phrase here, home learning environment, which I've just shortened in one or two places to HLE, home learning environment. And we actually, I'm just sort of showing one or two of these, but there's lots and lots of them in the Millennium Cohort study, so you know, quite a lot of granular detail. So basically what we see here, I think in contrast to some of those previous items, is that the gradient isn't that obvious here, right? And in fact, we've got the lower working class. I mean, more of them are saying they do this every day than the higher professionals. So yeah, basically we're seeing sort of high levels of helping kids with their maths homework, I think amongst most groups. So it's not like a very clear picture here of the inequality, you know, that you might sort of expect. A different picture emerges when we looked at some of those kind of creative activities that you might do at home with your kids. This one is musical activities, but we saw similar patterns with other sort of similar things, like telling stories, for example. And I've just added a couple of lines on here to sort of illustrate. So if we're just looking at this top blue bar, which is doing this every day, you know, some kind of activity with music at home, we're actually seeing that those in the working class families, the lower two categories, are doing this actually quite a lot more. A lot more of them do this every day than in the highest SES group. But we also find, if we just sort of zone in at the bottom there, that they're also more likely, right, the kids in these types of families, to never do those kind of activities. So we found this really interesting, that actually what's emerging here is absolutely not a picture of lower socioeconomic families doing less, but in some cases they do more, and in some cases it's a kind of picture of an inequality within that social class. We've got eating together here, which was one of the things that Robert Putnam had in his original book. There is a bit of a gradient here, so lower socioeconomic families are much more likely to never, or just one or two times a week, eat together as a family. And then we've got there's various measures of the quality of the relationships between parents and kids, but this one shows a quite clear, simple picture. This one is parents talking to their kids about their school reports, and obviously we can see that this is something that most parents do. But if you're in the lowest socioeconomic group, it's much more likely, to not have those conversations about how school is going. with quite a few sort of saying they wouldn't bother it unless there were concerns, for example. So that's all the charts I've got for the second chapter on investments. So here's the summary from the whole report. Obviously there are a couple of things in here that I haven't shown you today. So we also had some time use data here that showed that, you know, mothers are spending more minutes per day on average on these kind of developmental activities in the higher socioeconomic groups compared to lower. But let me move on then to children's lives, and this is the section where I'm going to show you the findings on well-being. But I'll begin with the data on, I think what we originally called, in the original report, norm-violating behaviours. So, you know, your kids being naughty. So we've got a measure of whether kids play truant at school and whether they've ever been excluded from school. Just to comment on this one, this smoking, drinking and drug use amongst young people survey was a survey run by the NHS that goes into school. We're relying here on a measure of what they call the family affluence scale. That's just split into high, medium and low. And although we do see some sort of little differences in the bar here, this is essentially a story of no difference, right? So we've got 18% of the high affluent and 19% of the low affluent saying they've ever been truant from school, and these are not statistically significantly different. I don't have error bars here because we didn't have them in the report, but I think from memory that none of these differences are actually statistically significant. So basically this is a story of no differences between socioeconomic groups, and then this was also a difference then from our original report in 2016 where we did show some differences there. The other thing coming from this report then was about the bad habits of these kids who are aged 11 to 15. And this was something that got a little bit of media coverage when the report first came out, and I think because this is not what people expect, and it's a story that surprised some people, and they chose to write it up in some media outlets. So basically, this shows what would sometimes be called like a reverse gradient, right? Because you're seeing higher levels of it in the highly affluent families than the low affluent families, and that's perhaps the other way around to meet some people's expectations. So we've got like 32% of kids aged 11 to 15 who drunk alcohol, I think it was in the past month. And we've got 13% of these kids who say that they've tried vaping, for example, and those levels are obviously higher than in the low affluent family. We kind of speculated in the report that, you know, kids in those families are maybe more likely to have access to alcohol, because it's certainly the case, I think, that you know, higher class adults drink more alcohol, so there may well be more alcohol at home. I'm going to move on to the well-being, or more, at least more sort of directly measuring well-being measures now. And for all of these, we're showing these over time rather than as a sort of single point in time. So that's a bit of a change to the previous graphs. The reason we wanted to do that is just because there's been sort of so much emphasis on, you know, in the news that this is an emerging crisis, that there's something different now to any point in the past. The other thing that I've done differently here is that on these, I'm going to show you graphs that give you the difference between boys and girls, as well as graphs that show you the difference between socioeconomic status. And it was simply because for some of these you see really, really different levels for boys and girls, and it was also something that the Commission wanted to see in this case. So these measures are coming from a a sequence from the British Household Panel Survey and Understanding Society. The dots on the chart are giving the point estimates from those various survey years, and the lines are smoothed trend lines, which are there to sort of help us to make sense of the noise. So they're a smoothed trend. This is a question about being a likeable person, and we're showing the percentage of these young people answering the youth survey who disagree or strongly disagree. Now the levels here are quite low, so we're just sort of up at about 9% or something in 2020. But it does seem pretty clear that over the last decade or so there's been an increase here, right, for both boys and girls. The levels have been up sort of higher in the past, so maybe this sort of mental health crisis or crisis in the well-being of young people isn't completely unprecedented, but I think for a few of our measures we do see an increase over the last decade. So this is the kind of the same question, so the same data. This time the two lines are showing us a high socioeconomic status and a low socioeconomic status, and we've got one graph for girls and one for boys. Sort of summarising, there's quite a lot of noise here. Obviously, I think many of these are a bit noisy and some sort of wobble rather than really clear trends. But a couple of takeaways here, I think for me, that almost always we find sort of higher levels of distress or lower levels of, they're all, so you want the measure to be low, right? That we're measuring a bad thing on the y-axis. And we're almost always seeing at all time points that people in those lower socioeconomic families, kids in those families, are going to be sort of more likely to be experiencing worse outcomes by these measures. I've got a couple of these questions from the same kind of battery of questions that are in a kind of self-complete module in the survey. This one is feeling sad about life as a whole, where they pick the kind of face icon to match how they feel. So here we see, again, worse well-being amongst boys than girls. In terms of the question about the overall trend, perhaps it's not so clear to say there's been a constant increase since the beginning of time, but certainly, again, it does look like this has been on the increase for about the past decade or so. Same again here, that we've got this now split for girls and boys by socioeconomic status. Similar kind of pattern, really, worse. The outcomes are worse for the low socioeconomic status girls. Another measure, and I think if any of them, this is the one that shocked me, because look at the numbers on the y-axis now, right? We're talking about much bigger numbers. So this question was asked about whether these kids feel nervous in new situations. We've only got this question going back to 2009, but you can see that the levels are really high, especially for girls. So 35% of girls are saying they feel nervous in new situations. It's pretty high for boys as well, but also here it does look like this has been increasing over time. Really high, so for low socioeconomic status girls, this is at 40%, it's up at 30% for the lower working class boys. I think there's one more from the sequence. This time I've got all four lines on one graph, so by gender and socioeconomic status. So the two lines at the bottom are boys and girls from the higher socioeconomic status group, and those reddish pinkish lines are the low socioeconomic status group, girls and boys. Again, it does look like there's been an upward turn recently, even if not going back to the beginning of the sequence. And so I think I think this is the last of the wellbeing ones. This one is showing us hyperactivity in inattention from the Strengths and Difficulties questionnaire. This one's been measured a bit differently. We've measured it in terms of how many times more likely compared to the highest class group. So we can see that kids in the lower working class are like 3 times more likely to have hyperactivity and inattention. Not showing it here, but you get similar kind of results when you're looking at emotional symptoms and conduct disorders. Interesting. I don't think we knew very much what to make of this in the report, but when we rely on the kids' own reports in the purple bar, we don't see differences at all. So the differences are emerging from the parent-reported measures. We can discuss that a bit if you're interested. And then I think my last couple of graphs relate to experiences of the pandemic. This is having a suitable device to work on at home. We can see big differences there. So quite a lot of kids didn't have a device or relying on their mobile phone. From the lower SES group, and similarly were much more likely to not have a suitable workspace at home. So that's got me to the end of the empirical findings. This is just a sort of summary that obviously we do see those stark differences. In terms of investments, it's absolutely not a case of lower class parents doing all the wrong things. But yeah, just think about those wellbeing findings. We're obviously seeing some important differences there. I think I can just skip through that one. And I've just put some links on here for where you can find the report. The one that's got reports in it is where you find the PDF. It took me quite some time to to figure that out. So that's it. Yeah, any questions?